Hi, everyone. Welcome to today's episode of Thanks for Sharing. I am your host, Jackie Pack. And today we're going to be diving into anxiety, something that affects millions. Anxiety is the most common mental health disorder in the world, with over 300 million people globally being affected. In the United States alone, nearly 1 in 5 adults, which is about 19%, experience an anxiety disorder each year. And it doesn't stop there. Over 30% of people in the US will face an anxiety disorder at some point in their lives. These numbers are staggering. And yet, anxiety remains deeply misunderstood. We're also looking at anxiety and how it affects Gen Z, with a book being written, The Anxious Generation. In this episode, I'm going to unpack anxiety. We'll explore its connection to depression and trauma, and discuss why certain personality traits are more prone to anxiety, as well as delving into how anxiety manifests physically. Of course, if you know me, I also am going to be exploring the role of our childhood environment, as well as essential strategies for treatment and management. So stick around and let's uncover this often misunderstood mental health condition together. Let's start by clarifying that anxiety is not the same thing as being worried. We know that everyone occasionally experiences anxiety. It might feel like getting nervous before a test or a job interview, or your first day at work at a new job. However, problematic anxiety is persistent. However, when we're talking about a mental health disorder, we're talking about problematic anxiety. It's persistent, it's overwhelming, and it disrupts daily life. It's your nervous system in hypervigilance, constantly in high alert. Interestingly, anxiety and depression aren't as separate as many people think. They're more like opposite ends of an emotional spectrum. With anxiety, it involves a heightened emotional response, while depression involves emotional withdrawal or numbness. We call it hypoarousal. And both represent emotional dysregulation. Think of anxiety and depression as siblings. They are related, but they are distinct on their own. Anxiety is the activation state where your body feels overstimulated, always on edge. Depression often follows prolonged anxiety, leaving you drained. And moreover, anxiety is often linked with trauma. People who have experienced trauma, especially during formative years, frequently develop anxiety as their nervous system becomes attuned to potential threats. Trauma teaches the body to anticipate danger, even if you're feeling safe. Constant stress, which eventually exhausts us, will often then lead to depression. I think this idea underscores the importance of understanding these connections for early intervention. Certain personality traits can also predispose individuals to anxiety, which I think is fascinating. And it may not be what you're thinking when you hear me say that right off. Research supports that people who are highly sensitive, creative, or deeply empathetic often struggle with anxiety. Dr. Elaine Aron's studies on highly sensitive people show that their heightened sensory processing can easily lead to overstimulation and anxiety. Additionally, research by Dr. Nancy Andreessen highlights the link between creativity and anxiety, suggesting that creative individuals often experience deeper emotional engagement, which increases their vulnerability to anxiety disorders. Empathetic people, as explored by neuroscientists Jean Dissetti and Klaus Lamb, can become emotionally overloaded due to their profound ability to experience others' feelings, further increasing anxiety risk. I've talked with one of my kids about this. She started experiencing anxiety at a pretty young age. And one of the other things that I noticed about her pretty early on, I would always say to her, you are a sensitive soul. My husband and I wanted to be very careful that we were not giving her the message that you're being too sensitive and you need to develop a thicker skin, toughen up a little bit. I loved the sensitivity and her ability to feel deeply for others. And we did talk about developing boundaries so that while you're feeling with others when they are expressing what's going on for them, at the end of that, you can walk away not taking that on and having those become your emotions or your stresses. And we would say to her, I think people with sensitive souls are amazing in this world. Often they're the artistic people in our world. And they're people who feel deeply. But this world isn't made for them. This world is often unkind and moving at a very quick pace. And these individuals will perceive and experience the world intensely, which I think makes them more susceptible to emotional overwhelm and anxiety. Again, I think these are important people in our society. They are the people who are creating art. They're the musicians, the writers, the painters, all of that. And they have an important part in our society. But our society also does a number on them. We know with Dr. Elaine Aron's studies, she talks about the crossroads between highly sensitive people. She's not using that as a pejorative label, but the crossroads of highly sensitive people and addiction, where they start using substances to try to manage some of their anxiety, and that can become problematic. So how does anxiety develop? We know that anxiety often emerges from environmental factors, particularly in childhood. I think a lot of people believe that anxiety is a genetic thing, that if your mom was anxious, then you're more likely to be anxious. Or if your dad had high anxiety, it's a genetic thing. But often we aren't looking at how that also impacts us in our environment. Growing up with a parent who is experiencing a lot of anxiety becomes something that you are picking up on as a child. So that's one way that anxiety emerges from environmental factors. Once we start experiencing anxiety, there's definitely some differences happening in the body. When I was entering the field, so this is back in 1995, a long time, that ages me. When I was starting in the field, there was a big question at the time asking, is it nature or is it nurture? Meaning, is it genetic or is it environmental? They were looking at a lot of mental health disorders and asking these questions. When I entered the field, my first job was working in substance addiction. We knew that there is some genetic tendencies when it comes to addiction. But the researchers were also asking, the environment in which a child is growing up with an addict parent is also impacting them. So is it nature versus nurture? And I think for the most part, we've solved that question by recognizing that as human beings, we have a nature that needs a lot of nurturing. And if that doesn't happen enough for each person, there's going to be some problems biologically and psychologically. We also know growing up in unpredictable, chaotic, or emotionally unstable homes will foster anxiety as a coping mechanism. Parental emotional regulation, or a lack thereof, can also play a significant role. If a parent frequently exhibits anxious or explosive emotional responses, a child will learn to constantly anticipate those threats. For example, a child with a parent who frequently overreacts or becomes upset, or it is inconsistent. So if a child does this one day and the parent doesn't overreact, but 2 days later they do the very same thing and the parent reacts strongly, that's going to likely develop heightened anxiety responses, leading them to try to manage or prevent conflicts. There's also some tendency for anxiety to develop in what we would call disengaged family systems. In disengaged family systems, I always think of family systems, we're looking at closeness and we're looking at separateness. So in disengaged family systems, there's too little closeness and there's too much separateness. As you could imagine, that's also going to leave space for anxiety to develop. So let's talk about anxiety in the body. Because we know that anxiety is not just a mental condition. It's not just happening mentally, like or psychologically. It's also physical. Anxiety comes with symptoms like a racing heart, tightness in the chest, sometimes dizziness, and we often know gastrointestinal issues are common. Your body reacts as though it's constantly threatened and floods with cortisol and adrenaline, activating fight, flight, freeze, or fawn responses. Chronic physiological stress can lead to health issues like sleep disturbances, chronic pain, and weakened immune function. This is why it's important to address anxiety holistically, understanding these physical connections and how anxiety manifests itself in the body. Now, I want to talk about something that I hear from clients and my staff asks about in staff meetings. They hear it from their clients. And maybe you've said this yourself. Why am I just now realizing I have anxiety? I'm in my 40s. Shouldn't I have figured this out by now? Let's look at why anxiety often becomes louder, clearer, and undeniable in our midlife. We know that you didn't suddenly develop anxiety in your 40s. More likely, you just ran out of ways to ignore it. In your 20s and your 30s, you may have coped with anxiety by staying busy, being productive, overachieving, people-pleasing, or numbing out and not being aware of your emotions. And we know that will work for a time period. But there comes a time in which those same strategies won't work anymore. Or worse, they start to backfire. Maybe it's keeping you up at night and you're having sleep disturbances for the first time. Or it's showing up in your body, gastrointestinal issues, a sudden panic attack when you've never had one before. And it can start to affect relationships. Often with the population that we work with, not uncommon for them to stop using substances and get sober. And all of a sudden, here comes the anxiety, and it seems overwhelming in their body. And often they do say, I've never been an anxious person. We know that our 40s tend to bring some big life shifts. We might be dealing with aging parents. Our kids are growing up. Sometimes they're leaving for college, giving us more time in our life. We might have careers that plateau or we've reached the positions that in our 20s and 30s we were aiming for. We often know that for many couples, the young child-raising years are busy in and of themselves, in addition to climbing the career ladder gaining more education, all of those things that people are doing to try to better their life in their 20s and 30s. And as kids age, we don't have that busyness. I've said this in other podcasts. I think the teen years, there's a higher need, not that our young kids don't need emotional attunement, they do, but in the teen years, that becomes more of the focus, emotional attunement, which doesn't add a whole lot more to our schedules. Our kids start to drive. They can take their siblings places, after school activities or extracurricular activities that they're involved in. We start to get some of our time back and some of our energy and effort back. Individually, we might start to feel a little stagnant. Our relationships might start to feel a little stagnant or strained. And we also, in our 40s, start asking bigger questions. Questions like, is this what I want? Am I happy? We might start noticing things. Why am I always on edge? Why do I feel like I'm waiting for something bad to happen? That kind of reflection can bring decades of unprocessed anxiety right to the surface. At this point in life, you're also likely to have more emotional awareness. You've read the books. Maybe you've been to therapy. You know what burnout feels like. And suddenly you're realizing that what you've always called stress is actually anxiety. And you might start connecting the dots, realizing that you've been living in a survival mode for years. Even if your mind rationalizes it, our body starts saying, hey, we can't just keep holding this. Our body starts to say, hey, we can't keep holding all of this without some health issues coming down the road. Suppressing anxiety and the emotions around that isn't going to work anymore. We may become aware of a racing heart. The dentist might start talking to you about grinding your teeth or a clenching jaw. We might notice an inability to sit still and ask ourselves, wait a minute, do I have undiagnosed ADHD? Midlife often becomes the moment when our nervous system says enough. And that opens a doorway to healing. If you're in your 40s or older, and you're now just realizing that maybe you've been anxious your whole life and never even been aware of it, I want to say here, that's not uncommon and you're not broken. This is a common age range where people start waking up. And with this awareness comes choice. This is a good time in the podcast to tell you that if this is hitting home with you, please share this episode with someone else in midlife doing this emotional heavy lifting. Maybe you've had a conversation and they're starting to recognize their anxiety. And if you want to dive deeper into how anxiety and trauma start to intersect, check out the show notes in this episode for more resources. I will experience with clients, and I think this was true for me, that the home that they grew up in, I will say the home that I grew up in, was chaotic enough that a baseline level of operation included anxiety. I was functioning with higher levels of anxiety than I should have been. And I see this for clients too. And then they may be experiencing the death of a grandparent that hit them really hard. They might be experiencing a cancer diagnosis with a parent and see that their life is now on the downward decline and time is limited. And they'll come into session and they'll say, I don't know that I'm really feeling this. I don't think I'm intentionally numbing, but I don't know why I'm not having emotions. Sometimes they're even saying, I see my siblings, their emotions are all over the place, but mine aren't. I'll ask clients, are you the type of person who's good in a crisis? And not surprisingly, a lot of them are. And I will say, yeah, so in this new situation, this new diagnosis, this new loss that has happened, when the crisis hits, you're pretty good in the crisis. And let's remember that these emotions that you're noticing are missing right now. They might show up in a couple of weeks. They might show up in a month. And it's surprising because clients, when the emotions do show up and they're delayed, they will come into session and say, I feel like crying. I don't know what's wrong with me. Everything's okay. And I remind them, hey, remember back here when you were noticing the absence of emotions? This might be them showing up. They're just delayed. They're just a little bit later than your siblings or than other family members, but they come. I also think for some people, as I was saying, anxiety was just a baseline from day one of their life or from very early ages. And they may not notice their anxiety until they start noticing the physical symptoms in the body, gastrointestinal issues, disturbances of sleep, a racing heart rate, and they are more likely to be going to the doctor regularly, managing their health, talking to their doctor, being more open about what they talk about with their doctor. And I know for me, when I've shared this before, 19 was the first time a medical doctor started talking to me about the anxiety I was experiencing. I was at college and I didn't know what was wrong. And I just had a painful rash break out on one side of my body. And I went in and the doctor said, oh, this is shingles. I'd never heard of shingles before. I didn't know what that was. And the doctor said, it's weird that you're 19 and you have shingles. That's not very common. It usually shows up later in life. And he started talking to me about anxiety and stress that I was experiencing. I was not aware that I had any stress. And I was telling him, I don't feel any stress. I don't think I have any stress. To which he told me, no, I don't think you're understanding. You have to have anxiety and stress for shingles to manifest in your body. If I had chickenpox, which I did as a kid. And I left that doctor's appointment with some directions for how to treat my shingles, which I really never want to get again. I have never had since then. And I need to get my shingles vaccination scheduled. That was very painful. But I left that doctor's appointment thinking, well, if this is stress and anxiety induced, then it's probably not shingles because I don't feel any anxiety. I don't feel any stress. Even though I had a lot of other body clues that my body was saying enough, my body was showing that it was overwhelmed, that it had had enough, and it was starting to say, hey, you've got to look at this, and we have to make some changes so that we're not living at such high stress levels. So I know for me, recognizing anxiety is difficult. I don't always recognize it. I still, sometimes my body will give me signs, say, hey, yep, you are experiencing it. This is a stressful situation. I think at my age now, I'm better at listening to my body and believing it, even if I wouldn't necessarily say, yes, this is stressful, or, oh, I am feeling anxiety. So let's talk about treating and managing anxiety. Anxiety, although it's challenging, is treatable. Effective approaches that a licensed professional, like a therapist, approach treatment with you include cognitive behavioral therapy, or otherwise known as CBT, which most people, that's where we start, CBT. And there is research indicating that it is effective to a point. Your therapist might also start with some dialectical behavioral therapy, or DBT, or they might add this to the CBT. And then there are trauma modalities that, as you've started to expand and explore the causes of anxiety, maybe you're having more awareness about how you were raised, the environment, how it impacted you, or this personality trait of being more of a highly sensitive person. There may be some trauma modalities like somatic experiencing, EMDR, lifespan integration, and IFS. And they might make a referral for medication when necessary. And again, think here of highly sensitive people living in a world where a lot of people are going around without emotions, bumping into people, stepping on each other's toes. Saying that figuratively, people encounter people and they don't slow down. They're not recognizing this is another human being, and they brush past. And we don't always interact with people as though they matter or that we matter. That, for highly sensitive people in and of itself, can be traumatic and cause them deeper anxiety. I know my daughter who experiences anxiety, and we've talked about this. If she goes to the doctor, she goes to the dentist, she's like, I'm just going to cry through the appointment. And fortunately, she found a good dentist, and she's found the doctors who understand that. They've asked the questions like, hey, is there something here? I asked her those questions. Was there something that happened with dentists or doctors when you were young? I was present for those visits, so I didn't know anything bad that would have happened with a medical provider. And she said, no, I don't recall anything either. She said, I feel like sometimes they are asking me, they don't come out and say this, but they're asking me if I was sexually abused. And she said, I haven't been, but I feel anxiety going to the doctor, and I'll probably cry. And I let them know that up front. They might ask me a few questions. And for a couple of years, she's 27 now. There was a couple of years in her adult life where she would avoid going to doctors or avoid going to the dentist. And we would have discussions about, hey, that's not good. That'll lead to bigger issues. She's one of my kids who, like me, has asthma. And I think when that showed up in her life, like 5th and 6th grade, that was traumatizing for her, because if you think about it, it affects our breathing. If you're struggling to breathe, of course you're going to feel anxiety. Of course that's going to feel overwhelming. And so as a kid, we always were managing her asthma. And as an adult, she was avoiding going to the doctor. And therefore her asthma was getting quite out of control. I would talk to her about it. I would encourage her to go to the doctor. I would say, I'll go with you if that helps. She was engaged and getting married, and I told her, I'm sure he'll go with you. He's a great guy. He's very supportive of her. He'll go with you, which he was offering as well too. And it was the weekend before they got married. We were moving them into a new house that they just bought. And her breathing was so bad. So she and I were driving in my car. We were coming back to my house. Coming back from her house to my house, we pass a Instacare. And as we were coming up on it, I said, why don't we stop at Instacare and have them look at your breathing? Because it was so bad, because she's moving, she's active. And she was like, I don't think I need to. I think I'm fine. And I said, hey, your breathing sounds like Darth Vader. This is not good. Let's just stop. We know that the breathing's bad right now. Let's stop. Get it checked out. And so we did, and I went with her. She didn't have me go back into the office with her and the doctor, but they gave her a breathing treatment. They prescribed her a more intense inhaler, and they made a recommendation to see a specialist. And she followed up on that. She came out and said they were shocked at how bad my breathing was. So I think it was a bit of a wake-up call for her, that she was trying to deny how bad it was getting. And going into the Instacare and having the doctor say, this is serious, this is severe, was a good wake-up call for her. And she has stayed on top of that. It took her about a year to get her asthma under control. She's been good at keeping those appointments. And that started her back going to the dentist regularly and following up on regular healthcare visits. But she does say, I just tell them, I'll cry. I'm going to cry. I'll be fine. I'm just going to be crying. And her experience with the medical professionals, what she tells me, they're good about it. They're understanding, they're supportive. They'll check in with her and they let her cry. So getting back to treating and managing anxiety. When anxiety is connected to trauma, we are going to need more than just symptom management. Symptom management is good, but we are also going to have to get to the root of the anxiety. Trauma-informed therapies like EMDR, somatic experiencing, IFS, lifespan integration can help people process and integrate the parts of themselves that carry those painful memories. These approaches work with both the mind and body, helping to rewire the nervous system and restore a sense of safety from within. Often I'll explain to clients that CBT, those are what we refer to as top-down modalities. They're working with our thought process. They're starting in the brain with our intellect, and they can be very effective. But when we're dealing with trauma in the body or the emotions in the body, it's top down only gets us so far, and we have to start with bottom up. So that's starting with what's in the body. These are the trauma modalities, and having that work its way up to the brain and to rewire things, both in our nervous system and in the brain neural pathways. And then for those with sensitive souls, those who feel deeply, who absorb the energy of others, who are often artistic and intuitive, the healing process has to include permission to be exactly who you are and to validate and value that. These individuals often will benefit from gentle, structured routines and environments that allow for quiet reflection and creativity. That's also going to matter who you're in relationship with. I've been saying this year, probably more than other years, not that this is a new awareness or a new thought to me, but I've been saying more in the groups that I'm facilitating, in my work with my individual clients. The people in our life have a big impact on how we are and what version of us gets called out or has to show up in the relationship. And so it matters who we're dating. It matters who we live with. It matters who we choose to let into our inner circle. Some recommended practices to make part of your routine when you're a highly sensitive person would include mindfulness and self-compassion exercises. These can help calm the nervous system and cultivate a kind inner voice, which is especially important for people whose anxiety is overly self-critical. When my daughter started a new job, this was 3 years ago, she had a lot of anxiety. She had anxiety that she didn't know how to do her job. And I would say, right, you just started it. You're learning. Let yourself learn. It's okay to learn. She would call me sometimes in the morning on her way to work saying, I think they're going to fire me. And I would listen and we'd talk about it. They weren't going to fire her. She would also tell me when she wasn't feeling anxiety that her boss gave her a compliment or her manager told her she was catching on so quick, more so than other people caught on. So I had that information and I have to remind her when she's overcome with her anxiety. I would say, you're just learning. Let yourself learn. It's going to be okay. And fortunately, she did have a good boss. She had a great manager and supervisor, which made a big difference. Sometimes she would call me on her way to work and she was crying. And I would say, what do you need from me? Do you need me to talk you through it? Do you need me to believe in you and affirm you and validate you? Do you need me to just be with you on the phone? Sometimes She just needed me to be on the phone with her while she cried. And then she'd say, okay, I'm parked. I'm going to get out. And I would say, okay, have a good day. You're going to be okay. Take some deep breaths. And that's all I would say to her as she drove to work. And the anxiety started to lessen. She started to realize she knew how to do her job. She was doing a good job. She got a lot of positive feedback. And then she was promoted. And we started over a little bit. Not too much, because her boss was the dean of the department at the university. And her supervisor was also one of the supervisors she had had when she first started, and who had sat in on her interview and was part of her hiring process. So she knew them, and she knew that they valued her, and that when the promotion became available, they had picked her, they had wanted her. So I think that helped. I've also reminded her, because she's 27 years old, I've known her for 27 years, I have reminded her, how many times has your anxiety been right? And the answer is 0. It's never been right. It's never even been a little bit right. Which anxiety goes to worst case scenario. It's preparing us for danger. And a lot of times we aren't in danger. We know that journaling or any kind of creative expression, writing, art, music, movement, can provide emotional release and insight. Spending time in natural settings has also been shown to lower anxiety and support emotional regulation. Not just for highly sensitive people, yes, for them, but for a lot of people. Disconnecting from the busyness of the world usually moves us into emotional regulation. Boundaries are also important. Learning to say no, recognizing what drains your energy or who drains your energy, and protecting your emotional well-being is also essential. There are also nervous system regulation tools like yoga, breath work, and any vagus nerve stimulation exercise that can help restore balance. And then we can never overestimate the value of building a community of people who respect and value emotional depth. That is healing, and it's protective. Therapy for highly sensitive people, for highly sensitive people. We've known for a long time that therapy with highly sensitive people is most effective when it's attuned, when it's validating, and when it's adaptive, allowing space for depth, nuance, and safety. We're also starting to learn with some protocols that the American Psychological Association just released a couple weeks ago, I think it was, when it comes to protocols for people who experienced complex PTSD, which is anybody with childhood developmental trauma. One of the things that their protocols also recognized was that the biggest predictor for healing was attunement in the therapeutic relationship. Often healing is not about changing who you are as a person. It's about creating the conditions where the sensitivities of a high sensitive person becomes a strength rather than a source of being overwhelmed. And for those who maybe don't identify as highly sensitive people, but also have a lot of anxiety, it still is not about changing who they are, but instead creating the conditions where who they are gets to develop, be appreciated, be validated in a way that feels safe. Medication can also be a helpful part of treatment, especially when anxiety is severe and persistent. Many people can experience significant relief through the use of antidepressants or anti-anxiety meds prescribed by qualified professionals. These medications can help regulate brain chemistry and start to reduce symptoms, making it easier for individuals to engage in therapy work and go to the deeper root causes of anxiety. That said, it's also important to understand the limitations to medications. In his book, Lost Connections, Johann Hari, the author, critiques the over-reliance on medication in modern psychiatry. It's a great book if you haven't read it. He argues that while medication can reduce symptoms, it does not address root causes of anxiety, such as disconnection from meaningful work, disconnection from relationships, and disconnection from a sense of purpose. He emphasizes that medication should not be the only treatment, but rather a bridge toward deeper healing that includes environmental, psychological, and relational factors. Emotional regulation skills like mindfulness, breathing exercises, and grounding techniques are equally crucial. Anxiety, though challenging, is treatable. Effective approaches, like I've said, include therapy, like CBT and DBT, and medication when necessary, but not in isolation. Emotional regulation skills like mindfulness, breathing exercises, and grounding techniques are equally crucial. Thanks for joining me today. Remember that understanding anxiety is the first step to managing it. You don't have to face it alone. Seek help and take gentle care of yourself. As I said, if you found today's episode helpful, please share it with somebody who also may benefit. And please subscribe for more content like this. Give us a review, leave a comment. And at the end of this episode, I want to remind you that your story matters. Remember, there's something meaningful in every chapter. Don't wait to share your story until it's finished. Until next time, Jackie.